Okay, I'm live.
I will be also as well in a moment.
Perfect. I hop on your StreamYard. Hi, Tukta. Hey, MB. All right. Well, thank you guys for coming here. We are going through a free birth society expose, kind of like exposing what's happening with this movement that is kind of like started where it's kind of like started as this birthing center idea of people kind of taking power over their own pregnancy, and it's kind of morphed into this thing of people getting completely abandoning the healthcare in regards to their the birth of their children. So if you can imagine that.
So while we wait for our
Sorry, I
friend.
have a little journal.
Yeah, no worries. If you have to step away, it's fine.
Okay. Yeah. Let me give me two
Sure.
minutes. Sorry.
Yeah, we got it. Yeah. Hello all. Hi. It is I, Prime, and our good friend Corey.
Hello.
So yeah. Uh, what started all this particular topic is that I saw a video talking about this article, but then actually read the article. This article is from the Guardian, and let me pull up the let me pull up the topic. It's about influencers making millions, pushing the idea of wild births. Okay. And so this is kind of a two-part thing. One, there's this idea of free birthing, and you may not have heard of that before. Free birthing involves like ha- giving birth, right? A mother giving birth without the help of any medical doctor, right? Like you just kind of, or no medical attendants. You just kind of do it your own at home or somewhere else if you want to do it that way too. It's a whole thing. So there's a free birth society. Well, sorry. Well, okay. There is a let me separate these things. There's a thing called the Free Birth Society. We're going to be examining them in a second, right? What I meant to say is like a free birth community, meaning that lots of people are doing this, right? Where they're deciding they're getting away from the medical establishment and doing it themselves. Now, the reasons why they're doing this are like interesting. Well, hold on, let's wait to Greg. All right, yeah. Hey, Greg, we're just going over free birthing. So
Perfect. Thank
yeah,
you.
yeah, I was saying that there's a free birth community, and some people, are doing this, giving, uh, not giving birth like within some sort of medical establishment or medical personnel, right? Not even necessarily a midwife. So that's what free birthing is. The reason why they're doing this is interesting, and we should be covering that too, like the reasons why people are saying that. That's free birthing. Now, separately from free birthing, right, is wild pregnancies. And that is an invention of the Free Birth Society, which is an organization, right? Not just a community, an organization, FBS. Okay. And wild birthing, or sorry, wild pregnancies, excuse me. Wild pregnancies are where you don't like visit a doctor at all through the 9 months. So people within the free birth community, like that's extreme. they'll like most people in the free birth community, from my understanding here, they actually do go to a doctor. They get prenatal care. They do the whole thing, right? It's just at the end they decide, hey, I'm not going to give birth with the help of medical establishment, right? That's one thing. But for FBS, they're like, no, we have to take it a step further. You don't get involved with doctors at all, which, as you might, as I'm sure many of you might imagine, can cause many problems. People can stumble upon danger that could have otherwise been avoided. Right? Very, very dangerous situation. So we're going to be examining that, right? Both like the idea of free birthing in general, without a doctor, and then much more extreme, right? Even within the free birthing community, this idea of wild pregnancies. So yeah,
it's a good summary.
Mhm.
And yeah, pretty wild. It's a in-depth article, and like yeah, there's some interesting, let's say, quotes and events in there, and like yeah, pretty extreme in terms of like well, no surprise, there seems to be some conspiracy theories associated with it. Oh, like you know, the belief that even ultrasounds are like harmful to a pregnancy, and like
yeah,
I think they use terms like what was it, obstetric violence or something along those lines.
yeah,
Um,
yeah.
where it's like, yeah, pretty much like, again, framing pretty much the entire sort of medical establishment as like they're out to get you. And there are bad actors associated with the medical establishment.
Mhm.
Thankfully, a minority. And as you alluded to, it seems like, at least from what I gathered in the article, there's a portion of this movement, the Free Birth Society, that like it's, let's say, whatever, not to legitimize it, but sort of at least a cognitively understandable response to individuals having a bad experience giving birth in the conventional medical system. That's obviously, in my opinion, a very poor response to it, but I can sort of understand the rationale. Yeah.
Yeah, people kind of already have so people have players that you guys might have heard, like the keywords, like a midwife. A midwife is someone that you basically like are hiring as like a consultant that has at least usually some type of like nursing background. So mean that they have like maybe some education on labor and delivery, but they will never have the in a birthing center or something like that, they'll never have the resources as like a hospital. And then a doula is kind of like farther removed even from that, where they again don't have any resources because you're not at a hospital. They are giving birth wherever, and then also they have no education on it. It's basically just someone like giving their opinion. And this has have been happening, when we started having babies like 9 years ago. This was a thing, like birthing centers, kind of like where you would have like a midwife or something. Was some people did it. It was like obviously very, I would say like more fringe, but unfortunately I feel like it's gaining with this maha thing, where it's kind of like people shutting away from healthcare.
So I want to be very careful here
Sure.
when discussing this. Well, two things. One, I just wanted to make sure I gave people the article so that people understand if they want to check out the article. It's a very long article, but
Mhm.
definitely worth the read. So it's on The Guardian, right? So if you search for The Guardian, the title of the article is "Influencers Made Millions Pushing quote unquote wild births."
Mhm.
Now the Free Birth Society is linked to baby deaths around the world. We're going to be talking about a lot of baby deaths, unfortunately, here. Because a lot of irresponsibility happening. But okay, but I do want to be careful in discussing this. One, there are reasons why a person would want to, like rational reasons, why a person would want to give birth outside of a hospital. In fact, there's a whole history behind this, and I think that's worth touching on. So there's that, right? And then there's reasons why people might, go to a birthing center and, be like work with a midwife. And responsible midwives Yes, they don't have, like our friend Greg said, they may not be as resourced as a full blown hospital, like a birthing floor, right? But one, like, they are very well knowledgeable in common problems that would come up, common emergencies. They can deal with a lot of those things themselves, and a responsible one will come up with a plan for you. Okay, right? So, like, if things go wrong and for whatever reason they can't handle it, right? Like, how do we get to the hospital immediately, right? They'll like come up with an emergency plan to make that happen. Like, people use midwives and it's fine. Separately, this idea of doulas, right? In case you don't know, DOULA, right? If you want to search for that, a doula. Um, doulas, again, as our friend Greg said, are non like medical professionals, but that doesn't mean they're not useful. So my understanding, and if someone has better information, please feel free to correct me. But my understanding is that other countries actually use doulas a lot, and what they are basically medical advocates, and like medical guides. So you are going through the process of childbirth, right, through pregnancy and all that. They help you navigate that system, right? Helping you like in each step of the way, and making sure the mother is comfortable and all of that, and then like even during actual like childbirth, like when you're in labor, like helping interface with doctors, which I think is extremely important. I think it's extremely important, and I'd really like to touch on this later on, because it goes to the reasons why this idea of free birthing came up in the first place. It's actually quite important. Other countries, I heard in the UK, that they use doulas like a lot, and I've heard like testimonies from women saying, like, because they were like surprised that women in America don't use doulas, and they're like, well, I can't imagine going through that process without having doula, without having someone to assist me there, because having a medical advocate can be extremely useful. I used to work in a hospital, and we had I worked with these nurses and social workers, but the social workers were essentially advocates for the patients, help them interface with what was happening in the rest of the hospital. Right, they worked for the hospital, which put them in a bit of disadvantage there, but so they weren't like an independent third party in that situation, but still their jobs were to advocate for the patient. That's a huge help for a person, especially if they have very little medical knowledge themselves, trying to like go through, especially the American healthcare system, like dealing with insurance and all of that. Having someone in your corner assisting you can be pivotal. So I don't want to like toss out the idea of doulas altogether. However, what these doulas were, so the people in charge of the Free Birth Society, they were doulas. We don't even know if they like did anything to do any level of training, right? There's some doula training that is available. I don't think they might. It's unclear how much of that they actually even did, right? But these individuals were absolutely destructive. The individuals in charge of the Free Birth Society, they were a danger. But yeah, that's from there.
Yeah, I mean, I definitely do think that like even the best equipped birthing center is as long as, so there are birthing centers that are inside hospitals, that
Mm.
so basically like UCSD and stuff, they will, if your birth that goes well and you have your everything is right, then they have a full birthing center with water births, everything that you would want, and that kind of like stuff. But any type of facility that's outside of the hospital is going to be inherently more dangerous to have a baby in, because when in a scenario like a birth that's happening where it's a baby gets stuck in the birth canal, or like there's a cord wrapped around the neck of the baby as it's coming out or something. I mean, we're talking like seconds matter, and in a C-section, like the fastest a C-section can happen in a labor delivery thing. I asked my wife, and she's a NICU nurse, so she goes as a advanced life support nurse, going to deliveries all the time for this, and she said the fastest that she's seen it is 8 minutes. So if you imagine, and that's when, like, imagine holding your breath for 8 minutes. That's what's happening. Your baby's drowning in your cavity. It's doesn't have any oxygen. So they are slashing It's called splash and slash. They splash the sanitization, and they just start slashing through layers and layers in order to get the baby out as fast as you can. Now imagine a birthing center having that happen, where they are calm. Now the midwife is like, do we call someone? Do we need to call someone? What's going to happen? And then you're calling the ambulance to come. It's like we're talking 30 minutes, plus in order to get to the hospital. So even the best intentioned birthing center that's outside of a hospital is going to be inherently more dangerous for that baby.
Yeah, that's probably true. I'd be curious, but like, I'd be curious to compare, assuming, or I take it that is true, that let's say the UK is more common to use doulas. I'd be curious to know like if there's any data on like the outcomes of like, are there greater complication rates, or like higher mortality?
But like, doulas aren't necessarily like, you could be working within the hospital being with a doula, right? So
true,
like doula and yeah,
that's true.
It's like a consultant, someone that's working with you. Like that would be totally fine. Like a friend. It's just basically a hired friend that kind of has gone through the system. I think that's like in general that's fine. But like in replace of, then it's like extremely dangerous, obviously, right?
Yeah, I mean they're not meant to be replacements. Like to be very clear, right?
Agreed.
Like a responsible doula isn't like but just for the audience, right? Like a responsible doula isn't saying that they'll replace a medical professional, that they can do that, or that is a good idea, right? Like that's like not their purpose at all, right?
I think largely there's like a supportive role, from what I understand.
Yeah, exactly. Yeah. So like these two women who began like these. I'm gonna try to keep myself from cursing, right? Like these absolute goddamn grifters, who started this free birth society. One did it for money. So let me give an audience a little bit more background as to like what we're talking about in terms of FBS. The free birth society started with this one lady who was like in some sort of doula program previously, but then kind of like screwed off, right? Left that, and like was looking to make money, right? And they decided like, okay, I got this idea for like free birthing. I mean, free birthing, it was before her, but like she like became part of the society. She started like going on social media and like creating a following, right? And what she was saying specifically was that like the medical establishment can't be trusted. Like she had, I mean, like it's really worth reading this article because the quotes here are just crazy, right? But basically, she talked about how like there's like obstetric. Say it again.
Obstetric violence, I believe.
Obstetric violence. Thank you. Yes, obstetric violence. That like they're basically, what we hear of MAHA in general, that there's a conspiracy against women. And in fact, you have the power inside you, right? Natural births, right? Like are good births, right? It's natural, and so it's good, right? And they said something. There was a line like if there's a healthy mother, right? Can go through a healthy pregnancy, and equals a healthy baby. That like basically, if you start off, as a mother, like ostensibly healthy, right? Then that almost guarantees you a healthy pregnancy and a healthy baby, a healthy delivery, and all that. Crazy, right? For all kinds of reasons. One of those reasons being, one, you don't even know how healthy you are, right? That's why we do the checkups, right? We don't know how the health of the pregnancy. We don't know any of that stuff, right? We go into these offices, and this person who might otherwise be ambulatory, be talking, be fully functional, she could have a ticking time bomb happening in her womb right then, right? But something that's addressable, because a lot of these things are addressable. But if you don't do that, if you just assume, because like I don't feel any pain, everything is good. Oh no, right? By the time you find out, it'll be too late. So in any case, right? Yes, like this woman, like magical thinking is happening here, and then she she reaches out for this other partner. The first woman, I need to find their names. I didn't memorize their names, but anyway,
I think it was Clark. Last name is Clark Norris or Norris Clark, something to that effect. But like, yeah,
I know Norris Clark was the second one. The first one was the Norris Clark is who was reached out to by the founder. Norris Clark was a rich white woman in the suburbs of Canada, and she had like a bunch of babies. She had a bunch of babies, right?
She had a litter of children.
A litter of children, a bunch of babies. And the founder of FBS, again, could one of you find her name? I don't remember what her name is. She reached out to because she hadn't given birth herself, right? And so she wanted someone with credibility. Like, well, how can you like tell me about these free births if you've never even given birth yourself, right? So she reached out to this other woman who's very much on the MAHA train, right? Even before MAHA, right? Like she's very much there. And like they start collaborating, and then they like launch this free birth society, and they make a lot of money convincing women to be a part of this thing. So just giving a little a little bit of background so you understand what we're talking about here.
Yeah, the FBS was founded by ex-doula Emily Saldaya. Was her name?
Saldaya, thank you, Emily Saldaya. Right. So Emily Saldaya reaches out to Norris Clark. What was her first name again?
Yolandi or Yolande.
Like Yolanda or something. Yeah. Yolande Norris Clark. She's the one who got a lot of babies. And they start to collaborate. And yeah, they convince people. They convince them to take a bunch of courses, right, and like buy material from them. They start off with a Facebook group, but then people start complaining in the Facebook group and like saying, "Hey, man, my baby died following your advice." Or I had like was seriously injured following your advice. So eventually they shut down the Facebook group and then like had like a walled off site, a paid for site behind a paywall. And they started making a ton of money that way, right? And he's just been keeping that grift going.
Yeah. Apparently, according to the article, since 2018, generated about 13 million in revenue. And there are some. As you,
if you're talking, Greg, you are muted. So sorry.
Yeah. I'm sorry. Yeah, I was. Okay. That's so much money, man. That's unbelievable.
But yeah, as you alluded to, there were some wild quotes in there where again, sort of along the lines, even that we saw this with COVID of like if you're a healthy person, it's like, well, your immune system can handle it, like no matter what. As in, if you're a healthy person, no matter what, like the healthy person is supposed to like never get sick. But then if you got sick, well, you weren't healthy to begin with. So it's like again, the narrative works either way. It's like if you're healthy, you don't get sick. But if you do get sick, well, that means you weren't healthy to begin with. Okay, so it's all on you.
And then they had this idea of radical responsibility, right?
Yeah, exactly.
So just very quickly, radical responsibility. It means that like you take responsibility as the mother, right? You take responsibility for the outcomes, whatever they might be, right? So if it's a healthy baby, or if it's an unhealthy baby, or if it's a dead baby that comes out after all this, right? You just take on that responsibility. They like teach the women who like come to their circle this idea, right? And it's great because it like puts the blame entirely on them. It individualizes the situation, atomizes them, right? And so your body, which they're telling you is some sort of amazing temple, this beautiful magical machine, right? That like produces great outcomes because that's just like spiritually, that just makes sense, right? Like giving birth is some sort of magical event. We use those words magic about giving birth. It's not, right? It's a natural thing. Like it's a biological process, I should say, right? It's a biological process that happens, and biological processes go wrong all the goddamn time. And so they're saying, well, because you have this magical body, right? You will, through the power of positive thinking or whatever, right, produce a healthy pregnancy. But if you don't, well, radical responsibility means you're certainly not going to blame me, right? Well, no, that's you. You somehow failed, right? That's all you. You made the decision, right? So there's no need to come at us, right? Like it's none of our concern. But yeah, sorry, Corey.
No, nothing to apologize for. Like everything you're saying is absolutely like obviously I agree with, and like just adding on to it of like again this inclination of like natural is good, and that like as you correctly alluded to, biological processes go wrong all the time. But then there's this mentality here of like, well, if it's a natural process, well, the natural process never goes wrong. And I think even like I don't know if it's an exact quote, but it seems like part of the overall free birth society mentality, it's uh, like they pass along the information of essentially the during pregnancy, as in the body will not produce a baby that is too big to pass through the birthing canal, right?
Yeah.
It's like that doesn't happen because the natural process, it can't be that way, because natural process, like, you're supposed to, quote unquote, go through the birthing canal. So why would the body ever? It's impossible somehow physiologically for the body to produce a baby that's too big to go through the birthing canal, which is that's all that the whole reason why C-sections or cesarean sections were developed in the first place. Unlike biological processes go wrong, as you correctly said, all the time, because there's so many things that need to be coordinated that it's almost not to I don't view it as a natural
You're
miracle.
use the M word, miracle,
yes.
aren't you?
Yes.
I mean, through gestational diabetes, it's like very common that babies get larger as you have them. So it's very common. And there's a quote in the article: as part of this Art and Guardian investigation, we conducted in-depth interviews with 18 mothers who suffered late-term stillbirths, neonatal deaths, or other incidents of serious harm after they or their birth attendants were heavily influenced by FBS. In all 18 cases, the evidence suggests FBS played a significant role in the mother or birth attendant's decision making, leading to potentially avoidable tragedies. So it's just so sad. I mean, every single case, if you think about it, every single case that's admitted to the NICU, which is the neonatal ICU, every single one of those would have been a loss of life previously, like 100,000 years ago. If we were just like free birthing.
Oh yeah.
Even just like 50 years ago or 100 years ago.
Yeah. The mom, the baby, or both would have been lost. In every single case in the NICU. I mean, so you have like the one in the article, like for example, okay, so you have things like the loss of oxygen to the brain, which is what we were talking about, which is one of the cases, hypoxic ischemic encephalopathy. And basically that's one of the things that happens all the time in the NICU. And they've actually have like technology in order to try to help this. So they have like cooling technology where they can actually like cool the body down so that you can reduce some of the damage to let it recover. Like there's the different technologies that they have that can help that if you actually use that stuff. And the problem is, as my wife was telling me, like the travel nurses that go and pick up these kids, they're too far gone most of the time, where you're just like, there's nothing that they can do. But if they were at the hospital, they could have, this is like, permanent lifelong damage or death that associated with this stuff. And it's like it's just like, we have the technology, it's there, and people just, they're abandoning it.
And to expand upon this, as you brought up, Prime, this aspect of radical acceptance, it even goes so far as like they frame it, or like the message that is sent to these women that choose to undergo or like buy into this free birth society mentality, is like this radical acceptance also sort of extends to like the fetus or the baby, as like the baby has to like choose life, and if they didn't choose it, well, better luck next time, I suppose. Like, as in like they frame it as like, if the baby's struggling to breathe, you got to like let them struggle, because they have to make the choice themselves, so to speak.
The baby, we got to understand what Corey's saying here, in case you're missing it, because it sounds so damn crazy. You must think, well, Corey must have said it wrong. No, he didn't say it wrong. No, like they say, the baby has to choose life, right? So if the baby has an obstructive breathing passage, right? It's up to them to figure it out, to choose life. Seriously, yes. And in the within the article, the woman Saldaya, right, the founder, right, she says specifically, because again, she's so part of this, right, part of the money making operation, was training other women to be not doulas, right? Was it like birthing? They had
it's like birthing keepers or something like that. But yeah, some
a very legally crafted name, very specifically legally crafted name, right? To dodge regulations. Anyway,
A radical
right?
birth
They basically
keeper.
want to radical birth keeper. Thank you. They wanted to basically expand the franchise type thing, right? Here's how you find other clients, right? Here's how you do what I do. And part of that was her giving this anecdote, talking about watching a birth and a baby having trouble breathing, right? Having some sort of in some sort of distress, right? And she making the conscious choice not to interfere, right? It's oh, she said she was trained by society, right? To expect babies to cry or something like that, right? Trained by no, expecting babies to breathe or something, right? Something wild along those lines, right? That's a societal expectation, and I had to deprogram myself from that. And so she said, I think it would be bananas, right? It would be bananas for me to interfere with a baby in distress, right? Or she used a different word there, but basically that was the sentiment. That of course I wouldn't do that, and it would be silly for you to do that, right? And okay, part of the issue here. Oh, sorry. There's so many things I'm just spilling out of me, and I do apologize, guys. I want to back off and give you guys more space to discuss this. But
love
No, you don't need to apologize. Yeah, keep going.
yeah. So people pay for doulas or midwives, right? Medical professionals, right? Some people are come at this because they're fully bought in to the FBS ways, right? To this whole idea, right? Some people are there, right? Which is in itself a problem, but not all of them. Some people are hiring these individuals thinking, oh, I have a professional who's going to assist me, right? So imagine you've given birth, right? It's a problematic labor, right? You're having trouble, and you're hey, help me. You paid this person thousands of dollars, $3,000 to $5,000, right? Help me. They're nah, I'm good. They told in that training, right? They told them in that training that if a baby dies and the police are called, that you lie, right? That you lie about who you are, you lie about what you're doing there, that you're just a helpful friend. They say you shouldn't even sign a contract beforehand and instead get payment afterwards, right? Because if something goes wrong, well then you weren't a paid professional there to assist, right? Instead you're just a friend. You're a friend observing, right? There for emotional support, right? Afterwards everything goes right, then you collect the money. These people they're goddamn evil. They're goddamn evil. Wow. Again, you guys read the article. I'll just say the name quickly again one more time. It's on The Guardian, in case you missed it before. Influencers made millions pushing wild births. Now the Free Birth Society is linked to baby deaths around the world. It's worth a read. It's infuriating, but worth a read. Sorry, go ahead.
Yeah, no, and absolutely. Just to again, I guess provide some quotes from the actual article, expanding upon again this aspect of the babies have to choose to breathe or choose life. So a little excerpt from the article. If an FBS trained birth keeper was attending a birth, Saldaya and Norris Clark taught that it was for the mothers, not the birth keeper, to decide if or how to help an infant unable to breathe. And quote, when I attend a birth, said Saldaya on a 2024 podcast, for example, I would never resuscitate a baby. That's cuckoo bananas to me, end quote.
That's so.
Yeah, pretty horrific and hard to comprehend. And yet they made lots of money off of this. And yeah, they pretty much double down no matter what. And even going so far as to again, frame it as, well, if the baby doesn't breathe or it's a stillbirth, that's sort of the natural outcome, or that's just that's how it is, not necessarily a bad thing. I think they sort of, one of them explicitly says that we don't consider a stillbirth or the baby being unable to breathe and dying a bad outcome. That's just that's the sort of
it's an
natural
outcome, just not necessarily a bad outcome. Just is what it is, right? It's the sun rising. It just happens, right? There's not any agency involved here. It's not we have other choices. They specifically lock these women out of the choices. And then another thing, right? This article again is so wild. It starts with it goes through multiple births that like went horribly wrong because of FBS, but the first one is extremely chilling, right? Like these people who like totally bought in to this whole idea, like are doing a free birth, right? And the mother is having trouble like passing the child, like like getting it through the canal. And then like it's surrounded by individuals, some of them from the FBS, others like in the area who came to like assist is a strong word here, right? But to watch, I guess, whatever, right? And they're like, no, it's good, like the baby will find its way or whatever the hell, right? The baby like, and it takes like forever to like get the baby out, and then the baby is quiet. The baby is not saying any is not saying the baby is not making any noise, right? The baby is like purplish, and just like laying there, and it was just like chilling, holding their breath. Yeah, no, it's fine. Like the baby will choose to live or whatever, right? And then all of a sudden, like all at once, they just decide, I guess we got to do something. And then like the mother starts like doing like CPR. And then others like go and like start like Googling and like trying to like get some emergency workers because they've realized, oh my God, what we've done. What have we done? The baby had like at least by before like the mother started CPR, at least 17 minutes without oxygen. At least.
Mm-hmm.
That baby is now it survived. Severely disabled baby, neurologically. The kid's like trying his best, but like he'll be like that for the rest of his life. This is what these people have done.
It's awful, man. I'm just thinking like our last baby was a C-section, and it comes out so different. Like it comes out so like purple and stuff, and I'm just like the look of the baby versus like a normal vaginal birth is just they're not, it's weird, they're not like squeezed through the canal, so they have like stuff in their lungs, they don't have that, they look different, they look more purple, and I can't imagine a scenario. And I was like, after it happened, obviously it's like you're in the operating room, so it gets passed to the advanced life support team. They're like working on the baby, trying to get up, and it was like the worst minute of my life, because I thought that we had lost that baby, and I was just like so sad, and I can't imagine a scenario like I'm just curious, like what's happening in their mind in that moment, because I'm so happy at that moment that we're in the hospital, we're having trained medical professionals doing everything that they can. I thought that she was gone, but it was really sad. But like, at least we had that medical help. Like I can't imagine in that point denying medical care or denying to give my baby the best chance in that scenario. That's the part that I'm like, are these people like, it's sick, it's a sickness. Like they're like a parent, they're giving birth for like a selfish reason. You know what I mean? She's like giving, it's like a birth like to make herself feel good, that she made this baby that could like withstand this thing, and that she could do this in order she could do this thing, as opposed to like having it be about like the baby. And it's just like a level of selfishness and narcissism that is just like unfathomable to me. I don't know. It's just
I think there's maybe a conversation to be had about like like it sort of like whether without getting, I guess, to the philosophical discussion of like what is a cult, but like people gravitate towards these groups, I imagine, for a variety of reasons. Some better than others. Like, is it just like a genuine mistake, or like is something going on with communities, groups like this that like it's sort of hijacking something in your brain, or is fulfilling a need that these people need? They're fulfilling a need in all the wrong places, type of thing. But like. Again, based off of in the article, like the case can be made that the founders of the FBS movement like sort of operate in a semi-cult like fashion. of like, well, yeah, like, it's the medical professionals that are like the bad guys, and so it's
Yeah.
like you have to turn to me as like your source of authority. I'm like, I have your actual interests in mind.
And Saldaya like lost her baby at the end. She like loses her baby at 41 weeks, which is a week past. Like so you have a stillborn baby? Like, so she's like, that's I don't understand. Like, what in that moment, and you're asking yourself, is there anything I could do better? Like, there has to be some self of realization, doesn't there? Like, what could I have done differently?
We got to be cautious about that statement at the end, right?
Okay.
Only because I know you correctly said what the article said, right?
Huh.
But like the article made an implication in there. So Saldaya, so this woman, right? She has at least goes through at least 3 pregnancies, at least 3, right? And I believe the latest one, at least from the article's perspective, was the child dies, right? The child dies. However, and she says it's stillbirth, right? However, a few paragraphs earlier in the article, she talks about how she like trains her people to lie, right? To lie about like what exactly happened. So if she says specifically about stillbirths, right? Like say that like the baby was stillbirth rather than coming out and then you not intervening, right? Like because
it was struggling to breathe, and then you let it just pass away.
Because you can be legally held responsible for that, like manslaughter or something, right? For not helping a baby. Even if you, not just the mother, right, not just the parent, but like people around the area, if you see like a baby being born in distress and you don't go and seek help, right? You can be held responsible for that too, right? And so she specifically tells her trainees, right? Like in the case a baby dies, say that stillborn. So at the end, when she says her baby is stillborn, you can't actually be sure of that.
Okay, gotcha. Yeah, I missed that.
Yeah.
That well, dang, like that's even more depraved.
Yeah. Disgusting. Again, she might have been telling the truth, but like she's a known liar, right? Yeah. So we can't be sure of it.
Well, it's actually it's part of the program or like the training of like because like they go through, they recount one of the stories where one of the mothers that gave birth and then or something was like off with the pregnancy, and like this mother wanted to go to the emergency room, but then she reached out to Saldaya saying, well, if you have to go, like lie to the medical professionals, or like don't actually say when. I think the lie is like, don't actually say that your water broke like 48 hours ago. Say it was like, your water broke recently. Basically, yeah, she encouraged one of the mothers, encouraged them to lie to medical professionals to pretty much cover up the fact that they are training them through this process.
Yeah, once again, everyone, like the article is really worth reading, right? Because like we aren't like as you can hear the moral indignation in my voice, right? But it really doesn't like get across all the nonsense. Specifically, the one he's talking about is like the death of this child later on named January Moon. And no, sorry, not January, Journey Moon, excuse me. Journey Moon was the child's name. And like the mother, like it wasn't just like she wasn't just in distress for a little bit. This like she had been in labor for days, like almost a week, I think, or maybe
yeah.
over
She was like, I know she like described like she was in pain for like a while, and like the alarm bells were going off, but then like so that was like more or less like, hang in there. This is how it's like supposed to be, type of thing.
Yeah, she was in communication with this woman. And yeah, the texts are nuts. You got to see the text; they're nuts. And like this woman, she's like leaking weird fluids, right? The mother leaking weird fluids and in indescribable pain, according to her, right? And like, yeah, she's like, Saldaya is just like, yeah, man, this is just part of the process. Like, don't worry about it, right? It looks fine to me, And then
like again, your body knows what to do, sort of like the message overall.
Yeah. This nonsense. Just like your body knows how to deal with like COVID or whatever the fuck, right? I'm sorry, exactly. I mean to curse. I'm trying to not to, right? Or whatever the hell. Like just like that idea. Yeah, your body would just like naturally figure this out. Well, it didn't. and she eventually did have to go to the hospital. Like our friend Corey said, she told this woman to lie to medical professionals about when it happened. In any case, right, by the time she got to the hospital, this is days later after going into labor, her child was like long dead.
Yeah,
just like
6 days,
probably rotting inside of her.
6 days. Okay, sorry, 1 second.
If you got to go, it's cool.
Okay.
No worries, friend.
Your children should take priority.
Like we're saying, very, very apropos. Yeah.
And like, I think there's many analogies to be made because it's like to a cult, because it's like how does like when this person is encouraging you to lie, all right, lie to like the medical professionals, and even like they even recount stories of like some of the mothers that were going through this that are basically following this free birth society. Understandably, some of their friends or family are not on board with this, or they're skeptical, and like they lie to their friends and family. And so it's like, well, again, it is a curious mindset of like, these leaders of this free birth society movement are like saying, lie to your friends and family, lie to your medical professionals. And it's like, how is that not a red flag to like, maybe there's something off here if I'm, supposed to be lying and covering up all that I'm doing to medical professionals and friends and family, right? But that happens with cults, like a lot.
Yeah, she's in 6 days of active labor, which is, that's like something's insanely wrong, right? I mean, come on. And then it basically texts Saldaya, and Saldaya says, some women fudge the date when their water's open. If you go in and say it's been open for 24 hours plus, they'll C-section immediately because they're worried about, an infection at that point. I mean, that's like, they're trying to get the baby out. Like, yeah. And then Holiday, the mom, texts back, good. I think I'm going to go in. I feel terrible about it, but I don't want to let my pride hurt this baby. Yeah, I'm not going to tell the whole truth for sure. Oh, wow. Should I say 12 hours? And then Saldaya, tell the doctors, quote, I recently began labor and my water opened this morning and it was a bad smell. And I thought it was the best to come in.
And what's, again, interesting is I'm sure there's, in this free birth society movement, there's probably a lot of talk about, whatever, again, around this aspect of, natural and all that stuff. But like, I'm sure they'll mention things like whatever, mother's instinct, mother's like intuition. And like this mother's like have the intuition of like, I should maybe start going to the hospital. And like they're being coached, like, don't ignore your intuition.
That's a really good point. They actively told them to ignore their intuition. Now, there's all this magical nonsense about how like the mother's body is sacred, and it will just like work itself out, right? And in fact, ignore any intuition you have to seek help. Nonsense.
Yeah. It's like the alarm bells are going off, like, the mother's instinct, which is intuition, is like kicking in. And it's like, no, the medical establishment is out to get you. Ignore that. This is all how it's like supposed to be. It's like, yeah. Very
well. Let's start addressing that because I think that's a very important part. And like you said before I do that, Greg, you said like you were reaching out, hoping people will join in terms of like parents or people.
Yeah. If anyone has any like distressing, well, I mean, if you're thank you for sharing if you would want to, but any like I know these they can be complex, but hopefully kind of like say how medical intervention helped save the life of your baby during your pregnancy. And I mean, I have one. During our first baby, basically as he was coming out, like the cord was wrapped around his neck, which is a weird, intelligent design if you think about that.
Perfect design, guys. Yeah, thank you.
And thankfully, mom's hooked up to an oxygen monitor, trying to make sure, like looking at the heartbeat of you and the baby, and the oxygen of the baby's going lower. So they're trying to give mom oxygen, and then thankfully they're monitoring that stuff, right? So then the OB comes in, he just he goes right up in there and slings the cord around his neck, and that was it. But my wife decided to do non-epidural births in our pregnancies. So I just imagine you know, like a scenario where being at a birthing center or something like that, where you know the baby's not being monitored correctly, or the oxygen levels aren't being happening, and then guess what? Like that wasn't caught in time. There wasn't an OB that's trained to like go in there and save. You know, basically, it's the exact same oxygen deprivation problem that that kiddo had in the story. So it's like
Yeah, that it starts off with of like I think
Mhm.
they literally did not see the cord wrapped around the neck.
Yeah,
Uh,
it happens
and
all the time. It happens all the time. That is like my wife said that is the bread and the butter of the NICU. That happens
yeah, and that's
Yeah,
that's the part that's surprising.
we have a couple stories in chat. Kimmy, first baby HG preeclampsia. So preeclampsia is like your body is like reacting to negatively to the you know being pregnant, and it's like not going well.
Mm.
One or both of us would be lost without intervention. And then the second baby was too large to fit well, basically plunged out after hours of being stuck. Yeah, that's Kimmy. I've had friends that have had that happen too, where it's like 12 hours of birth, I mean, of active labor, and then basically getting stuck. And then you have to like have that, you have a crash C-section at that point to try to get the baby out as much as they can. Um, yeah, the third baby smooth. And at that point, you have to, and once you've had a C-section, you have to be going through your third and fourth, in order you have to have a C-section anyway. You know what I mean? Once you've had one, you have to your abdominal, like the wall isn't strong enough in order to have a natural birth. It has to be like 7 or 8 years, and even then, like a lot of OBs won't even try it. So, yeah. So yeah, it happens a lot, man. It really does. The stories happen more than you would think, and it's
Yeah,
So,
like I think I mentioned
crazy.
like last week or the week before, like being out in nature is harsh. Like you don't want to be like out in nature, just like relying on like absolutely nothing. Like we have all these technological advancement for a reason. Like you want clean water, you want medical technology.
yeah, yeah, the I saw a lot of comments people talking about this in this other video, and people were, were like making the points, right? Like one, like toxins, like your poisons are natural, right? Like they're a natural part of life, right? But we can understand they're dangerous, and like nature is just tolerant of like a certain percentage of women just like dying, not making it
Yes,
through life. That's what it is, right? That's how it's always been. Like just a certain percentage of women just like they don't make it. They don't make it, right? And they just kind of been like weeded out of the gene pool that way. That's how nature rolls, right? But we have the power of like large brains, some of us, and we can use those, right? Employ those to help us out, right? To increase our chances, understanding all our lives are precious, right? And all these mothers' lives are precious, the babies' lives are precious, right? We can actually increase their chances of living. So let's just kind of do that.
yeah. And as someone in the chat said, I mean, it's such a good point. Like the U.S. Like mortality is already so high. Like it's wild to like in the United States be like, you know what, I'm gonna go even further. Like it just doesn't make that much
I want to
sense. Man.
drag those numbers down even further.
Yeah,
Right?
like I don't get
Exactly.
it. Like what is and they have, you know, the hospital will work with you to have a birth plan, right? They'll have you like, and it's honestly a great intro to becoming a parent, because it's your plan, but that is not what's going to happen, and it's a great rough draft. But yeah, it's like just with kids, it's not going to
Wow.
happen that way. And like my wife would say, like they'll say like, oh yeah, well, you know, they're in the NICU, their baby just had this traumatic event, mom just is coming out of like surgery or whatever, she's coming in, and then the mom will come in and be like, okay, this is what I want for my birth plan, this and this. And she's like, my wife's like, you're in the NICU, this is not in your birth plan. Like this is all out the window, man. Like this is this is never a part of anyone's birth plan to be in the NICU, you know. And
Wow.
it's just like it's very weird, because it's like the OBGYNs, the NICU nurses, labor and delivery nurses. Like obviously it's incredibly, like nursing already is female dominated, but like these fields specifically are even more female dominated. So the idea that like these people are really there for like camaraderie, helping people, and education. It's just
I'm gonna look it up in case I'm incorrect, but my understanding, so like in terms of nursing, you're correct, right? But like gynecologists and like OBGYNs, right? That they overall like are more male. Like there's
Oh,
more
really?
male. That's my understanding. I'm gonna look it up. I'm gonna look it up.
I know. Interesting.
But that's my understanding, and that's always been a big problem for women.
Interesting. Wow, I didn't.
So but and so I'm gonna look that up and I'm gonna check that in a second. Or Corey, could you look that up for me
I
and
can
see
look
like
that up,
the
absolutely.
sex ratio, please? Thank you so much. But I want to use that as a transition point to go into why these women are making this choice right now. Like one way or the other, free birth society is crazy, right? Like to be very clear, I'm not like at all excusing this society or the two women, Saldaya and Norris Clark, who I created they are grifters, and these people should be in jail. Absolutely, charges need to be put against these individuals. Right? They are utter criminals. But okay, understanding that, like, why are women making this choice? There seems to be multiple reasons. One is like just plain ignorance, especially when we're talking about like first time mothers. I think there is, like as we've talked about here many times before, there is a lack of education on like people's bodies, right? Like on sex education, on especially women's health. There's just not enough information. Like women aren't always taught like what their periods mean, right? And like their cycle and all that, and like what does the maternal process actually look like? Not like the happy version that you see in like a TV, right? On a show where like, oh, there might be a little bit of trouble, but it kind of just works out, right? Within 30 minutes, it works out. No, the birthing process is a lot, right? And so people, those women, right, that cohort of women, kind of just like find this information and think like, oh wow, this appeals to me. This is a slight tangent. I'm gonna get back to what I was saying before, but like I think from that article it was kind of clear that the people who like jump into the free birth society, there was a type, right? It was a very lefty, naturey, like crunchy, I guess is the word people like to use, right? Type that was like attracted to that, right?
The people that use Gwyneth Paltrow's goop. Okay, the crystal.
Yes, exactly.
Okay,
100%. Yeah,
pretty much your LA hippie.
Yeah,
your crystal
exactly
mommies.
that. And crystal mommies, yeah, a lot of them were attracted. Remember, these are the people who first made it MAHA, right? Before it became a right-wing thing. It became
the OG anti-vax movement, really.
Yes, it was a left-wing thing beforehand, right? It was like the wellness thing was a left-wing thing. Then it turned into a right-wing thing. But in any case, right? That's the type of people targeted. So anyway, so those are people who just don't know, period, right? And don't know like yes, obviously, it would behoove you to have medical professionals into like helping you along these paths, right? However, and this is the part that I really want to touch on, is the other cohort. There are people who it's not so irrational. There are people who have been hurt by the medical profession, seriously hurt by the medical profession. And this happens in all kinds of areas, but it also does happen when we're talking about individuals giving birth, right? Luckily, like my friend Dr. Greg, him and his wife have had good experiences with the medical profession, like doing what they did, making sure their children made it out okay, and that's great. But for others, it's not, right? That high mortality rate, right? So like it's often discussed, like that the U.S. has like the highest mother mortality rate among like developed nations, right? Yes, that's a problem. One, it's a problem in general. Two, it's a problem more in certain communities, right? If you are, brown, right? If you're black and brown, that number goes higher. Right? If you're just looking at those communities, that number goes higher. And those like there is a tradition within the medical profession of doctors not understanding or caring to understand about like the pain of Black and brown individuals. That's a real thing, right? And causing a lot of damage along the way, right? Doctors are just people, and like the general public, right? Like it's a crapshoot as to what kind of person you get. Really, a loving, caring person is going to take you seriously, or a person who doesn't look at you as fully human. That's the thing that happens. There are ones who have made medical mistakes, right? Like they might have been honest medical mistakes, but like medical mistakes nonetheless, right? Or because they didn't listen to the individuals, right? A cousin of mine, she nearly died. She nearly died giving birth. And she nearly died because the doctors were ignoring her. My cousin, the one I'm talking about now, is a nurse, is an actual nurse. She understood like something was wrong when she was giving birth, right? Something was wrong. I don't know the exact the medical situation I was having her, but like something was wrong, and she was like asking for help, and they were ignoring her, right? The people around her ignoring her until like she forcefully made her case. And if she didn't get that help, like they like took her to her surgery, right? And she had waited a few minutes longer. If they had waited a few minutes longer, she would have died. She would have died. This story is tragically common, right? It may not always end in deaths, right? Because, and that's the point I want to make. We look at the mortality rate, that's bad, right? But like there are people who survive, but also are just like suffer huge traumas, right? You can survive that and suffer huge trauma. You can survive that like my cousin, right? And you can logically make the case, right? Like those people did not care about me. I was hurt. Sometimes maybe my baby was hurt. We survived, not part of the mortality rate. We survived, but maybe my baby was hurt, and I can't never do that again, right? Mm-hmm. There were in the comment section of the video I was looking at, right? There were a mother saying I was one and done because of what happened in the within the medical profession, right? With those OBGYNs, because of how badly they treated me. It was so awful. I'll only have one baby because of that. So, in wrapping up all this, I'm sorry, guys. So what I'm saying is that like it's not crazy that these women are making this choice, right? Like the problem is that we have not addressed these issues, right? For white women and women of color, right? Both suffer. Some suffer more, but like both suffer. We haven't taken women's health seriously. We haven't given agency to women where they feel like they're powerless going into these medical settings, right? They're suffering trauma. We're not actually dealing with that, and so they're looking anywhere, right, to get that agency back, and they're making a choice like this. This is a bad choice, but it's not irrational to seek other options.
Yeah, I agree. That's why I sort of alluded to in the beginning of like, there are, again, cognitively understandable reasons why some mothers would choose or gravitate towards this. I can cognitively understand of as a result of being traumatized from an experience in the conventional medical system, turning away from that. That happens all the time, not just in this context here. We're like, yes, as a result of failures in the medical system, people turn to, bad answers, but what they perceive as better answers nonetheless. But then also just to address this aspect of the statistics of OBGYNs. There's one study that I found from the American Journal of Obstetrics and Gynecology, looking at data from the Association of American Medical Colleges between 2007 and 2018. And they overall conclude that on average, across the 12-year period, academic physicians in obstetrics and gynecology were 43% male, 57% female, 68% white. And their overall conclusion is, across the 12-year period, the representation of women and racial minorities has increased in academic obstetrics and gynecology in the United States. There is now a predominance of women, but there remains a trend for a predominance of white and male physicians in higher academic ranks. And this was published in 2020, so should be fairly up to date.
Yeah, Dr. Keisha Davis is in chat. Hi, Dr. Keisha Davis. Amazing podcast, guys. Really tackling a lot of these issues too about like women and healthcare and everything. And I think that she had a good question, like taking those questions, like why not ask like a qualified OBGYN to those questions, like those problems that they have. I think like having, I think like taking that to like another person, as opposed to taking those questions to someone that is, I think.
Sorry, what questions are we talking about? I'm a little confused.
Sorry, in my chat, Dr. Keisha Davis was talking about having just asking those questions about the failure of like the birthing center, or the failure of the medical system to, like, why not like take it to another licensed OBGYN or something like that, having someone that is more like qualified, rather than I think the idea is to try to like give the medical like professional and give them the chance in order to try to like answer those questions and fix those wrongs, or develop those relationships.
I don't necessarily disagree, but sometimes the reality is sometimes you only get one chance. If you blow that one chance, people are just going to turn away from you.
Yeah. I think a lot of it, I mean, people get these, it's tough, man. I mean, there's a lot of things that can go wrong, and it's not necessarily the fault or anything that someone does in the medical profession when they do it, that it's like, and people kind of like lay blame sometimes when they've done the right thing, and it does happen, and it's sad. Something tragic does happen, and my wife has it all the time, like with the NICU, where people want to blame them, and it's a really traumatic event, and people are very understandably so, very fraught about it. But at the end of the day, it's like, it's the best decision to always go with, the medical. It's always the best.
I mean, yeah, I agree. And in an ideal world, if someone has a bad experience with one particular OBGYN, sorry?
Okay. Sweet. Thank you for inviting Keisha Davis. Dr. Keisha Davis invited Sharon Smith, Dr. Sharon Smith here. So perfect. I think she's an OBGYN. Perfect.
Oh, fantastic.
Amazing.
Yeah. If they want to contribute anyway.
I invited Dr. Keisha Davis when she came in, so I'd love to. Yeah. All people are,
by all means.
We could co-host too if you wanted. Hi.
Yeah. Hello.
Okay, cool. Hello. Perfect.
Hello.
Okay, cool. So we got
Dr.
Keisha Davis and Dr. Sharon Smith.
I invited her, but let me tell you, it's like Friday night.
Mm-hmm.
It definitely is a laid back time. Hello, y'all. I do understand in these conversations. No, this conversation is very sensitive. Okay, as a Black woman, as a woman who is a Black woman physician, and a friend who was a Black doctor that lost her life in this situation, it's very sensitive. And I think when you cultivate these conversations, you need to be just aware of that, and have the people that live it every day when you're having it, not just to have it, just personally, okay? Especially when you're talking about women and Black women. And I don't see one that is such there. I just personally have that, but we did a whole deep dive. I think it's called, I've never seen a 5-second C-section. Is that what it's called? We had 3 Black OB-GYNs on the conversation talking about Black maternal health in depth. It's on our podcast, on our platforms, The Medical Collective. But off to you, Dr. Sharon.
Yeah, I came because you summoned me, because I've never encountered.
I know. I'm telling you, she wouldn't come up here if it wasn't for No,
I know. It's not that I wouldn't. I just have not come across
this space. I know.
Yeah, exactly, this space. But I am happy to educate or, give light to maternal mortality on a whole, and even particularly Black maternal mortality.
Dr. Sharon, also they were talking about free birthing in these birthing centers.
Yeah, we were looking at the Free Birth Society, the Guardian, kind of like expose talking about it, and the dangers that are associated with it.
Absolutely, because I am the one who will be on call and literally racing to save these women. When I tell you women come in, like we can't find a blood pressure on her, and I'm calling a rapid response and, you know, mobilizing emergency release units of blood from the OR, and people literally standing at the bedside, squeezing blood into this person. I'm, you know, emergently open the belly and with her whole entire body of blood just pour out on me. And I'm literally, and that's what I deal with people who are birthing at home. Or someone comes in with a shoulder dystocia and the baby's half stuck out of the vagina. And I have to, you know, do maneuvers to get this unfortunate unalive kid, you know, delivered, or mom come in seizing, or just all these crazy things, ruptured uterus. I've been in practice for 17 years now, outside of residency. If you add residency, that's what, 21 years of experience. And when I thought about it, I can't believe it's that length of time, but I've definitely seen a lot. I work tirelessly and very hard to keep women alive. I've not lost a mom. I never want to ever lose a mom. So I always work hard and feverishly to save women, and I will continue to do that.
And Dr. Sharon, remember, wasn't it recently you just had a case that was a free birther, wasn't it? Or wasn't a free birther? It was it was with a midwife at home, right?
Yeah, she was having a VBAC, which is a vaginal birth after cesarean delivery at home. And they call me, I'm telling you, they call me 5 minutes to 12. I'm literally less than 10 minutes from the hospital. I threw on my clothes, ran to the hospital, and I was 10 minutes from the hospital. That's how close I stay. 5 minutes from the hospital, they call me again, and I'm speeding on the highway. They're like, we can't get a blood pressure on her. So I'm like, call a rapid response. Our rapid response is a team we call when people are just about to code. So they call the rapid response team. I got to the parking lot, like I'm like sprinting up the stairs. I saw someone drawing blood. The first thing I asked is, does that blood clot? Because that's all I need to know. I need to know what does that blood clot? I'm like, activate a massive transfusion protocol. I need O negative blood. Send me, go run for the bucket of blood now. I put an ultrasound on the belly. There was no heartbeat. The husband was actually holding on to her. I literally dragged him off of her and wheeled her to the operating room and dragged her on the OR table because I knew she needed surgery. At that time, I thought she had an abruption, which is when the placenta prematurely separates from the placenta prematurely separates from the uterus, and that cannot sustain life. Either way, she was critical. She was like near unalive, and I had to get her on the OR table. Got on the OR table, do everything. Someone's putting another another IV. Like we have 50 million people working on her at the same time. Then anesthesia is trying to get a good history. And she's completely out of it. And then next thing we figured out I actually looked at her belly and saw a scar on her belly. And I'm like, oh shit. I said, she has a ruptured uterus, let's go. So I basically splashed the betadine. Through the betadine, I didn't even scrub. Did not scrub, there's no time for scrubbing. Threw on my gear, got the knife, went down, and out flew this baby, her whole body full of blood, and the placenta. She had a ruptured uterus from attempting to birth at home.
By people that don't understand the risks.
Right? So after I've raced to massively transfuse her, and I'm like, and then she was oozing on the table because now she's coagulopathic from all that massive blood loss. So I have one problem, then turns into another problem. Luckily I was able to catch up. I closed the uterus, it stopped bleeding, because most often people like that end up with a hysterectomy. And now this was 12:30 in the morning with a hysterectomy, but luckily I closed it and it stopped bleeding. And the nurses looked at me, they're like, Dr. Smith, you saved her uterus? I said, yeah, I sutured it and it stopped bleeding. They're like, she's gonna fucking come back here next year with the same shit. I'm like, I'm sorry. Right, because this was like, well, once I'm done and I got the history, this was her 12th pregnancy. She had birthed most of her children at home. A year and a half before, she had an emergency C-section, had a procedure in her uterus the year before for retained placenta. And then here we are with all this multiple instrumentation on the uterus that had a dangerous situation for someone who had no business attempting a vaginal birth at home. I did counsel her extensively. No, because she was lucky that I did not do a hysterectomy that night. But my feeling was, it's just because of the community she belongs to, she was going to continue future pregnancies.
It's almost like a cultish like mindset behavior, because Dr. Sharon, we have seen this like since the beginning of the pandemic. There are truths. Yes, there are truths about Black women's mortality. The error rate that was spoken of earlier is actually incorrect, because the error rate with surgeries is not high, and that's not the issue. The issue is that, if you don't have a trusted doctor ongoing support, then you're not going to see the same outcomes as someone that sees a Dr. Sharon on an ongoing basis and is going to get the prenatal care that they need, right, and not get lost. And then, of course, yes, postpartum period is very important, and having a patient advocate or somebody with you is very important. But what's getting lost is in the midst of this distrust that some women have for healthcare, and trust me, I'm a Black woman, Dr. Sharon's a Black woman, we understand it, is that now people are harping on it. You got chiropractors, you've got people that are not MDs harping and saying, well, because you don't trust them, come this way. And they're leading you astray. Instead of finding a better way to have your birth plan, you're deciding you're not going to have a birth plan. And you think being 5 minutes from the hospital, when actually 5 minutes to Dr. Sharon, means that that baby or that mother cannot be resuscitated in time, because 5 minutes does not mean 5 minutes direct to the OR.
Actually, 5 minutes you have, is 5 minutes is enough to develop ischemic encephalopathy, right? I mean, I've literally gotten from incision to baby out in less than 30 seconds.
Wow.
When I have, that's why I think these are, Dr. Keisha have a podcast named 30-second C-section, but literally.
Yeah, that's where the conversation was, and that
Wow.
like literally, because I've had to, I don't, you know, no, let's go. That baby heart rate went down. It didn't come back up. Let's go. I got less than a minute. I mean, I've had another thing that I've seen that come in from home is a cord prolapse. Oh, Jesus, why? A cord prolapse. And you guys can, I mean, I don't like to send people to Google, but you can Google that. But because that is like an extreme emergency. That even in the hospital, if you don't have everything mobilized, that can really be a bad outcome. And that's when the cord prematurely delivers before the baby, right? So that cuts off all oxygen supply to the baby. And that's a race to the OR to get that baby out in a swift manner. You know, and I've had a home birth with that. When the baby was gone, it was gone. And I mean, and I understand that there's distrust in the medical system, but home births are not the answer. It's not the answer.
Yeah. So first of all, I'm very thankful for both of you for coming on. Exactly the perspectives that we needed. So that's like absolutely fantastic. And so what I was saying previously, and I would love to understand like your response to this, right? Like it seems like you two are acknowledging that people are suffering pain within the system, right? And again, I agree with you. Like, so you're going to get no pushback from me that free birthing is not the answer, right? We're making that very clear. Hey, you need medical assistance, right? Like, absolutely. But you know, this article, and it's a fantastic article from the Guardian. I'm going to read a paragraph very quickly from it, right? Emails flooded into FBS, Free Birthing Society, from women who had experienced life-affirming unassisted births. Many had previously had traumatic births in hospital. The obstetrician gynecologist who delivered writer and birth worker Caitlin Pearl Coghill's second child in 2015 performed a membrane sweep, an internal procedure to induce labor, without her consent. He subsequently lost his license for having a sexual relationship with a patient. Quote, he was a creep, says Coghill, and he was abusive, and it definitely felt like sexual assault. So this is just like one example of this individual, and it's not like the worst I've heard. This one was actually, I've heard worse than that. So like, how do you feel that we address this? Because what I was saying previously is that like people are choosing this, just like in terms of like anti-vaxxers, they're choosing this because they feel like a lack of control within the medical system, right? That people within that system have harmed them, and then they don't want to try it again. So like, how do we address that?
So whenever I encounter a patient, in fact, this actually happened to me last week. I encountered a patient who had a very traumatic birth for her first baby. So she came in extremely nervous. First, you got to acknowledge someone's trauma and pain, right? I can never brush that off. I don't walk in their shoes. They have to tell me what their pain is, and I believe it. And actually, one of the nurses that helped me take care of that told me that before I even went into the room. She said, hey, doctors, but her last baby was a shit show. I said, okay. Then I went through and I looked and I read everything that happened. So I went in and I sat at her bedside and I spoke to her, right? And first of all, I told her, I said, I did go through your history. I understand and I see what happened the last time. And I said, I'm going to give you my word that I would take the best care of you I know how. And what happened the last time is not going to happen under my watch. Right? So then I told her everything I was going to do and why I'm going to do it. And I allowed her to ask questions. And I told her, I said, you can ask the same questions 50 million times. I said, I don't care if you ask the same question 50 million times. I will answer it 50 million times in different ways so that you can understand and educate you. Right? Mm-hmm. So then she relaxed and she became much more, comfortable. And then, so I did it was a repeat cesarean delivery, everything went well. I spoke to her throughout the entire, to the entire procedure, showed her baby when I delivered the baby and then gave the baby off to the pediatrician. And then, and everything went completely well. But I sat at her bedside and assured her that I'm going to minimize or reduce or completely eliminate that trauma that she had from her first delivery. And she went home happy and very thankful and grateful that I took my time and went through everything with her and explained and allowed her to ask questions and answered every question and held her hand through every single thing, even as the anesthesiologist put in her spinal, held her hand, laid her down, stroked her head, gave her a cool towel to help her feel better so that she knows, or she knew at that time, that she was in good hands. So it takes going that extra step, that extra mile, which I have no problems doing it. I have taken care of women who've had SE. I've taken care of women who had genital mutilation, right? I've taken care of women who they were having a baby and they're like, I'm not pushing because I'm not having this baby because I didn't want this baby. My husband raped me and this is how I ended up with this baby. So you really have to be sensitive of everybody's trauma. And that is how I think we will have to, that to me, that's kind of the only way we're going to change the narrative. Whereas people just go elsewhere because they feel that no one's listening to them. No one's acknowledging their pain. So, and it doesn't help. It really does not help at all.
Nope. You remember what Dr. Sin said too, is we have to realize too that a lot of us have a lot of knowledge, right? So when you go into these situations, and even my friend, when we were in medical school at the time, I think residency, and she called me because, her husband wasn't listening when her heart rate dropped, is to have an advocate or have somebody there. I know that's easier said than done, but you've got to have a plan together. You've got to have somebody there and communication. And listen, I know when it comes to OB, if you are in a rural area, that's a different situation, right, Sharon? But if you aren't in a rural area and you have a choice, or even in a clinic, get to know the other doctors in case someone else will deliver you. Get to know the staff and have that comfort and let them know. If they don't answer your questions, ask again. Write them down. Remember it. Put it in the note section. Know your patient advocate. Yes, there's ones for the hospital, but there's also, I have a whole list on our website, medical-collective.net, under patient resources of patient advocate sources that you can find, like outside ones that are neutral that you can go to, especially if you're trying to heal from a traumatic medical situation. But running from the science of medicine and what OB-GYNs do is not what you solve it with. You solve it by making sure you have a plan and trying to fix the system. But the system is not going to be fixed overnight. It's not.
Yeah, I'm curious, like, what do you guys think about like institutionalized kind of like trying to root some of this stuff out? I mean, obviously with the administration right now, it's not going to happen, but like I feel like these like unsafe birthing centers, like I don't understand how they can even be legal, because the people could think that they are safe, you know, and obviously they're not, you know, and I don't think they should be allowed.
I mean, they shouldn't be allowed. I mean, the stipulation, like for me personally, just knowing that the thing is with OB, things can go from 0 to 100 real quick. I cannot tell you the amount of time over my career, including residency, that I've literally dragged a stretcher out of the hall and run down the hall with the stretchers. I need anesthesia. Come, give me the blood, give me blah, 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 now. And in 2 minutes or less than that, I have that patient on the OR table. If they have to put her to sleep, they'll put her to sleep really quickly. I don't care if you count, give me the scalpel, and I go to town, get that baby out, and then we'll catch up after. Baby out, I'm good. I can wipe the pee off my shoes or wipe my pants after I'm done. Because it literally is like, okay, all right, breathe. The baby's out. All right. You know, now look over the anesthesia. You good? How's her back? Is she doing good? She need blood, blah, 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 you know. And that's how we do it. But I cannot tell you the amount of times things go from 0 to 100 real quick.
Dr. Sharon, someone said in the chat, maybe you need more well-experienced midwives. There's a caveat with that because, again, at the end of the day, when it comes to needing an emergency procedure, a C-section, whatever is being done still needs to be done, in my opinion, and Dr. Sharon's, within a hospital setting. That's where we're failing. We're, again, at home, 5 minutes, even if you're 5 minutes away, even if you're across the street, you're not going to get there in time. And is the doctor going to run down? I mean, you're thinking in utopia, if you're going to get there in time to be able to get the help, like she said, what can happen within a few minutes. That's why you need to be in a hospital.
There are like some of the hospitals that I cover, there are midwives in the hospital and I cover the midwives, right? Because obviously they can't do a C-section, or if they need an instrumental delivery, like a vacuum or something, then they're not trained to do that. So then that's where I have to step in and do that. And I've done that.
And Dr. Sharon, free birthing is like another level from that, though. I don't think people understand. That means not having anyone.
Yeah, it's like not having anyone.
Why would we go back to a time when our ancestors lost many children?
Yeah, no prenatal whatsoever. It's insanity.
So there's two different types, right? So yes, free birthing would be exactly what you just described. But then there were this idea of wild pregnancy, which this organization, Free Birth Society, they were pushing. The most extreme version of this is yes, no prenatal care, period, right? Don't talk to a doctor. Don't go to these professionals. They're like exaggerating the problems that you'll face. It's like pure insanity. So like the organization that we've been talking about, and I know Dr. Sharon, you're just coming into this, right? There's this a fantastic article in The Guardian, which you're gonna hate because it's it's infuriating. But I'll read the title again if you ever want to check it out. Influencers made millions pushing wild births. Now the Free Birth Society is linked to baby deaths around the world. And this was this organization.
You know, these articles come from actual other studies, and then Guardian puts it out. So like these, we talk about this stuff all the time. Like I'm sure she talks about in her group, but and the most recent story, there's actually another one coming out, Sharon. I think I sent it to you. The most recent story about it. The question is, will they be accepted? Will these free birthers be accepted at the emergency room when they need, help? Well, of course they will. But the question is, what will happen when they get there, right? Because if you start having, I can't see his name at the top left, my eyesight at night. If we're having more free birthers, these large societies, when there's complications arising, they're going to have to go to an ER. And I hope you guys know that not all ERs have full OB capabilities sometimes, especially in the rural areas.
I just want to ask a question so I'm Canadian, so I have to sometimes remind myself that, I'm speaking with Americans. And like, this is not something that like factored in so is it possible, pretty much I'm asking, is it possible that people are choosing free birth or these wild births, pretty much foregoing the medical system because it's like cheaper, as a cost saving measure?
I thought it was like $6,000 in order to do it first.
No, I'm just talking about. I'm not talking about just specifically a free birth, but I'm just talking about also just like people foregoing like having home births like in general.
Oh,
because in Canada, that's much less of an issue. I'm not saying there's no cost whatsoever.
Yeah, they talk about in the article underground births where people are just like doing this themselves, and one woman in the article talks about how like the cost is a factor here, and so I guess what Corey is getting at is that, like, looking at our medical system, in which, yes, there will be a bill at the end of this. Like, do you see women who are presenting here saying, maybe I showed up, I was doing this because I wanted to avoid going to the hospital in the first place because I couldn't afford it? Is that something that ever happens?
Yeah, that is basically the crux of my question.
Generally, no, because actually for pregnancy and prenatal care, they get the Medicaid if they do not have insurance. Or I've seen people who have medical insurance but no obstetrical coverage in their medical insurance, and Medicaid covers that pregnancy. So that is not, Medicaid will cover the prenatal care and the birth.
Being pregnant and having children is the one time where the state now, stuff is changing, but the one time that you are covered. So I don't think that's even if that was the issue, Sharon, we already know that's why not people aren't coming right to the doctor, or it's either access or getting in to see a doctor, or the distress, or taking off time from work. It's the whole thing about it. It's the same thing with what I'm seeing with colon cancer now. That's even more different because that does require insurance. You aren't guaranteed to get coverage for that. And the problem is that people wait. And even if they are all holistic, natural, but then when the emergency comes, they want to come to the hospital at the end, or the measles cases. It costs so much more to recoup from an emergency than it does for preventative care.
I mean, we don't turn away anyone. I don't ask you what your insurance do. Listen, I don't care about any of that. All I need to know is what I need to do for a good outcome. And if you're presenting to me and your baby's unalive, okay, I'm sorry about that, but my concern now is keeping you on this side of the earth. That's it. I don't care what insurance you have or what you don't have. No, that's not my fight. Nope. Not interested. Don't care.
I wanted to go back to and I'm sorry, I didn't catch your name. Dr. Kendall, was it? Dr. K? Sorry, what was the there's Dr. Sharon and
Dr. Sharon.
Sorry, what was the first one? What was your name? Sorry.
It's me, Keisha. It's Dr. Keisha.
Dr. Keisha. Okay, yeah, sorry. It was like you faded out, but thank you so much, Dr. Keisha. I like what you said previously, talking about health advocates and how important that was. I was talking about that previously when we were specifically in terms of birth, talking about doulas, having someone just to help you go through the whole like system and and be by your side and like push back where like it's appropriate to push back. Like I'm thinking of it in like expanding this out, not just from births. Just again how the medical system treats people of color. You may be familiar with this particular case. It was extremely galling. The death of Susan Moore. She was a physician. So she died during the COVID pandemic. She you can there is a Wikipedia page if you guys if
we know her. We know her. We know her.
I'm saying I'm talking to the audience here for them if they want to take a look at. Yeah, no problem. But yeah, there's a Wikipedia page, and I'll read from this just talking about how she was treated. Right. So she comes down with COVID. She's admitted to this hospital, admission to Indiana University Health North Hospital, and it says Moore tested positive for COVID-19 on November 29th, 2020, and was admitted to IU Health North Hospital for care. On December 4th, 2020, she shared a video to Facebook in which she described how white doctors refused her pain medication, which she said, quote, made me feel like I was a drug addict, end quote. She also recalled begging for treatment with the antiviral drug remdesivir used to treat COVID-19 patients not on a ventilator, in addition to begging for a CT scan. She reported that a white doctor said, quote, you're not even short of breath, end quote, although she was at the time. In the video, she stated that, quote, I put forth and maintain if I was white, I wouldn't have had to go through that. This is how Black people get killed when you send them home and they don't know how to fight for themselves, end quote. So she gets discharged from that hospital and then like admitted to another hospital eventually later on, and she does eventually die. But like this treatment, and what I was saying before previously is that like, yes, there's a mortality rate, but not just the mortality rate. There are the people who survive, right? Who may not end up dying, but the people who like get hurt. Or suffer some sort of traumatic experience. And so I loved, Dr. Keisha, what you were saying about like having advocates, how important that is. Because people, like they give up a lot of agency to doctors, right? Like, hey, trust your doctor, right? I mean, we're saying it right now. You should trust your doctor. But
that's not what I mean by using a patient advocate. I think that's where the problem is with looking at replacement. It's a team, right? It's not you're using a patient advocate because you don't trust your doctor. You're using a patient advocate to have the conversation and to basically be able to make sure everything that you're trying to say is met and to fill any gaps in. It's not because you don't trust the doctor. A patient advocate cannot replace a physician, does not understand what they're doing, the ordering of the test, what the procedures, but will help you and guide you, and also in payments, right? And social services. So that's what the patient advocate is for. Go ahead, Sharon.
I
and
agree.
there's nuance to that story about the doctor that passed away.
Sure.
Go ahead, Dr. Sharon.
Yeah. Yes, we know. We know Dr. Moore. And I mean, what she says is correct. Like, I've had loved ones who have been hospitalized, and I've had to reach out to my colleagues and say, hey, my mom's in the hospital. Can you please go by? And I would tell my mom, I say, hey, such and such is going to come by and see you. And can you give her permission to talk to your doctor on your behalf? Because if they can't get me, I'll try to talk to her doctor directly. But I've had to advocate for my own family. I've had to change physicians for my own family. I find new physicians for my own family. So this is something I've been doing for a long time. Or even tonight, even on TikTok, someone asked me for a physician here in Houston. And I sent them to a friend of mine, that someone I know who is good and who will take care of them. So there's a constant advocacy that's needed, necessary, and has to continue. This systemic problem has to change. It's not going to change now. But in the meantime, we need advocates and patient. I mean, they do have patient advocates in the hospital. And when people get to the hospitals, I tell them to ask for a patient advocate to help them, navigate the healthcare system. But it is problematic. I'm not going to lie. It is. It is.
Yeah. So, and Dr. Keisha, I wasn't thinking you were saying that the patient advocate can replace the doctor. No, well, I'm along your lines. I'm saying that going through this, especially when you're dealing with something major or emotional or like just difficult, right? That you may not be able to communicate, like you're saying, right? Communicate properly with your medical team. People say like, and even outside the medical field, people talk about like even having an advocate with you when someone has passed, right? And you're like making financial decisions around the estate or like the funeral process, right? Because funerary agencies like have been known to take advantage of people, right? Because they're grieving. They'll like make all kinds of like not very intelligent financial decision at the time. Just having a friend there, right, who can communicate like what your actual needs are when you may not be able to at that very moment is actually extremely helpful. So again, like I'm saying, is like I think you're correct, and that this is what we need to like push forth in the system. Like I used to work at a hospital, and I worked with social workers who did exactly what you're talking about in terms of bringing additional help to patients, helping advocate for them as they were going through the process. And I saw how useful that was for these individuals. I'm saying, yes, we need more of that. But I'm curious if like that's, and I don't know this, I have no idea, right? But I imagine if like these are internal workers in the hospital, I wonder if those departments tend to get cut first because they're not money makers, right? Like when these hospitals who are being defunded, who have less resources, I imagine that's a department that is very sensitive to those pressures, right? Where other departments, money makers, aren't.
Well, first, I think you're getting a little confused. Just for people, the patient advocate and the purpose and the doula's purpose are specific and kind of overlap, but the doula has a specific purpose for a birthing woman versus and pregnant woman versus pregnant person, versus a patient advocate, which can be used for different circumstances. Dealing with an estate and stuff is not the patient advocate. That's something else. And the hospital patient advocates are at the end of the day working for the hospital. So sometimes even when you try to file a complaint, there is nuance around that. And hence why I gave a list of patient advocates that are actually work for themselves. Actually, one of them is our friend, Dr. Nicole, who is a physician turned patient advocate and has a whole thing. So she has a leg up because she has the experience of being a physician, a pediatrician, and now she's a patient advocate. So if you're looking, I really implore you to look into her. She has some blogs in there too on her website. But just to tell you that, I think Sharon was going to say something.
Well, no, not really, but I do definitely. If anyone goes into the hospital, like if I'm hospitalized, I need somebody to advocate for me, because if I can't speak for myself, or I'm just not with it, and I hope and pray that never happens. But who knows? I need someone to be able to advocate for me, just the same way I advocate for my own patients and advocate for my family and friends. Because not because I'm a physician. Because we've had, besides Dr. Moore, the other physicians we know who have passed away unalived in the healthcare system, due to whatever lack of care. I think just even recently there was a midwife, wasn't in South Carolina, who passed away in the hospital after birth. Did you guys hear about that one?
Yes.
I did not.
No.
No.
Oh my gosh, I can't remember her name, but yes, she is a midwife who actually, she became a midwife to advocate and try to help the same system that essentially unalived her. So from what my understanding is, and this is just from an outside view, she had to be delivered at 32 weeks for severe preeclampsia. So if you got to be delivered at 32 weeks, premature, 8 weeks earlier, you have to be severely preeclamptic. So apparently she had a cesarean delivery, and then they said what I read is before discharge. So I guess a day or two later, she had a complaint. Next thing I heard, they rushed her back to the operating room. She coded on the table and unalived. So I'm not sure exactly what happened. It's either she had internal bleeding, or the next thing that I can think about is what we call a bowel evisceration. Those two very critical things. But yeah, just within the last few months, maybe, I can't remember her name, but I'm sure if you Google midwife who passed away in South Carolina, a midwife, it was actually even all over TikTok. Right. So
we get the stories first over here.
Huh?
I said we get the stories first over here.
I think it's probably
we always share with each other. Yeah, we're always finding.
Yeah.
I have one last question I'd like to ask you too. So about the state of like the field, right? Our friend Corey, he was talking about some statistics about like, who makes up the field, who makes up OBGYNs. And then like now it's, was it more than half is like 57%?
Yeah, around 67, 60%-ish, give or take. Yeah.
Around
50, I think it was exactly like 57%.
Yeah, are women, at least according to that study of whenever it was taken.
Mm-hmm.
Do you think that the field would be much improved if like women were like vastly overrepresented in terms of OBGYNs? That like, do you think there's a difference in care between like, not that like male doctors are bad people or anything like that, but that there just tends to be a difference in care between female doctors and male doctors, and in terms of race? Do you think that makes a substantial difference if if you can understand a person's cultural experience or whatever that might be, right? Do you think these things make a difference, or maybe we should be looking to somewhere else to like make these women more comfortable?
I do. So we already know that female physicians have better outcomes than male, right? That's statistically proven. Mm-hmm. And then, so that in itself, and I will tell, and I have examples of taking over care of women who are under the care of a guy. And when I go in and I go through, I do what I call chart rounds. I go through the chart, go through everything and stuff. I'm like, okay, so where's the H&P? Everyone who comes in and gets a history and physical. Like, where's the history and physical? Where's the H&P? No H&P. And then I go through the labs. I'm like, why is a white count 40? I'm like, that's crazy. Your white count shouldn't be 40 after delivery. And then it was 30 and 40. And then when I went and spoke to her, she's like, well, during the pregnancy it was 20. I'm like, why is your white count 20 and 30 than 40?
Oh my Lord.
And I'm like, okay. So I'm like, immediately, I'm like, you got a cancer somewhere because this ain't right. And you know what?
This is the one with the limps, right?
Yes.
Did she get a
and you know what he did?
What?
He ordered Zosyn antibiotic, and I picked up the phone because he ordered Zosyn, and then I spoke to the nurse. She's like, she's bacteremic. I'm like, how is she bacteremic and you don't even have a blood culture? What are we treating? She has no fever, no clinical signs of an infection. She has a high white count. there is something else going on with this patient. I said, she needs to see hematology, oncology. She needs a blood differential, whatever the stains and whatever you guys do in the lab, Dr. Keisha. But I'm telling you,
said we don't work in the lab, Dr. Sharon. Oh, now you need us. Okay.
Yes, no, I do. Right? So, and I spoke to him. I said, listen, and I called him because I was coming on. He ordered, and I'm like, what are we treating? And he had a big gun antibiotics. Big antibiotics. I'm like, she doesn't have a fever. I said, she has a white count that has been trending up since her prenatal period. I said, she needs hematology. I said, I can't tell you what her diagnosis is, but this is not right. There's something else going on, and it needs further investigation. He was just going to treat a white count with antibiotics. Right?
So I do think we have, right? I do think that people are getting lackadaisical. And this was an older man, right, Sharon?
Yes.
And we're not men bashing, y'all. We're not.
No, I'm not men bashing, but women do, patients on the whole do better with women physicians, right? Mm-hmm. And I've seen it. And I think also in the realm of OBGYN, and granted, I have worked with some really great male OBGYNs. There's some that are really outstanding, great surgeons. I'll call them if I have an emergency, some really outstanding ones. But I've seen some that I'm like, the hell, you should not be practicing. The hell, I need to get my patient delivered before you're on call, because we're not doing that. No, for real. I'm taking over a patient. I got to go through everything because you're going to get my ass sued. Honestly.
But Sharon, even at the end of the day, I think women's health is the one specialty where, I am sorry, but for most women, especially those that may be Muslim, that may have a certain religion, and for those that may have personal trauma and history, they're going to want a woman. So you should be dominating that field. And you remember we had I don't want to call him a colleague, but you remember there was a male OB-GYN who put that on Instagram and people went after him when he says, I don't know why you guys choose women when there could be a better, male alternative. And he said it wrong, of course. But at the end of the day, why would we not? It's our health, it's our bodies. And we feel more comfortable with a woman going in our private areas. Of course. I only had women OB-GYNs and I don't care. That's my choice.
I mean, I've seen women who've had laceration from birth and it's been poorly sutured. Now she has pain with intimacy and I got to take her back to the OR and try to repair it and make it better. I see that. I've seen that a lot.
Yeah. Okay. Yeah. Thank you for your.
I'd be amiss if I didn't ask you both before. But you guys can stay as long as you want, but I give you guys the out if you want. I would love to hear your thoughts on the Surgeon General nominee, and it's not to open up a huge can of worms, but
I don't know her. I don't know her. Nice dresses, nice shirts. I'm not sure. But, ain't no way a trainee going to be governing over the practice of medicine and guiding physicians when she's never, ever been able to guide herself. And I think it says a lot about people, and we really need to look into ourselves and think about when we go for positions, are we ready for them? Are we worthy of that position? Have we earned it? And it is crazy in this day and age, and shame on her for thinking that she's worthy of a position when she's never been able to prescribe medicine without being overseen by an attending, has never practiced medicine. And you guys do know that when you finish residency, then you get your board certification. She doesn't have one. What does she have? She doesn't have one. She does not have a state residency. She didn't finish residency. That should be a red flag for you. If you want to go be a health coach, then you can go be the surgeon health coach. But to be Surgeon General, you're supposed to be a medical doctor. We've got to start dumbing down society.
I agree.
She's not qualified, right? She never, she graduated from Stanford, right? Stanford Med School. never finished her residency. So because to be able to sit for your boards, you have to be, your residency program has to certify you and say that you are eligible to sit for your board, meaning that you've done well, you have no issues, yada, yada, yada. You sit for your written boards, and most specialties also have an oral board at some point in time after that. So she quit before that. So she doesn't even have a practice. She doesn't even have a license. I'm don't quite remember if you have to finish residency to get all your license complete, because I think it's just up to step 3 and you get your license, or you have to completely finish your residency before you get your license. Either way, she doesn't have a license. She's not board certified in ENT or anything. As a matter of fact, she quit and became a functional medicine. So how are you going to be the doctor of all doctors in the United States? I'm not even qualified for that position. I have no public health degree of public health experience per se, but I'm still more qualified than she is.
Girl, I mean, you were more qualified the day you finished residency. And, you know, the most problematic thing that she said was that all these specialties, we have more chronic disease, the more specialties we get. You have to be kidding me. You're going to knock, again, they're knocking people, they're knocking higher education. She said that the problem with medicine is there's so many specialties, because she probably didn't finish. I'm sure there's something that happened that they were finally like, we have to let you go. And it probably was a blessing that she decided to leave, because could you imagine misguiding her patients and telling them not to get immunized and them unaliving?
Yeah, I mean, how rare is that?
As a surgeon, I don't think she would have been able to do that.
I mean, how rare is it? Like it was like an ear, nose, and throat surgery, like residency, apparently, and
she wouldn't have been able to practice. There's no way she would have been able to practice like that.
But like
that's what.
But leaving, is it like? I guess I'm curious. Like the numbers, is that? It seems extremely rare.
It's rare, but not extremely. What I usually see is I've seen a lot of people. This is another thing people do, is they finish medical school and get an MD, and then they don't make it through. They don't match for whatever reason, and they go and do other stuff. And then I see some of them still use their medical degree as a doctor, but it's a doctor on paper to me. When I finished medical school, I didn't do nothing. That literally, you had 2 years of clinicals, you just had a real whirlwind. And then not until you get into residency are you truly learning about your specialty. So I've seen that as a problem. And I've seen a lot of people get into residency and not make it all the way through. Getting to the last year and not making it all the way through, she was probably skimming by the bare of her teeth. She probably was getting warnings, I'm going to tell you, or she probably was told, you withdraw or we're going to remove you, which would look bad as a mark.
She's I think it's worth understanding that when she left and she went into the whole podcast circuit, her and her brother, I think, right, they're a duo, they struck gold within MAHA, right? There's a lot of money to be made here, and so like this is like the podcast presidency, like the people that he's hiring. I mean, honestly,
right?
Our Secretary of War, was a Fox News host. And
except our podcast is the bomb.
Yeah, I understand. No, fair enough. Yeah, we don't want to install all podcasts. Yeah, fair.
We all have at least 2 to 3 board certifications, so there is that.
Yeah. And these individuals, they've made so much money here, and this shows just in her answering her questions, right? When one of the senators was asking her to certify that she believes that vaccines save lives, and she was avoiding saying the thing, is because she has a whole audience, right? She has a money-making machine behind her, and if she says that vaccines are good, right, well, then she destroys her money-making abilities. And so this is the type of the people we're dealing with, right? Not serious individuals, people who've found a niche, like scaring others and taking advantage of medical trauma, like we've been talking about here, or just like general medical ignorance, so we shouldn't be surprised that these are the ones who are picked up, right? Because all Trump is looking for, all this presidency is looking for, this administration, are people who are do well within the Fox News circuit, right? And the Fox News circuit has always looked for people exactly like this.
And also keep in mind, generally this is, that side of the political aisle. It waxes poetic about meritocracy, this person has no credentials whatsoever, right?
Let's take them. But that's by design, so they will not know what's happening.
Exactly, their insecurities.
Even when she's speaking, she does not know what's going on at all. She's completely confused. And the good thing is, though, she has not been confirmed yet.
Yeah.
So let's see if your colleague, Dr. Sharon, let's see if your colleague on our side will say no. Let's see if he's a man of his word now.
Senator Cassidy.
Yeah, I call it her colleague. She can't.
I know why you're giving him to me. No, thank you.
I know. I mean, he was the whole thing. He was like the whole reason why he was the deciding vote on RFK, and the whole thing was he was not going to restrict vaccine access. So, fool me once, shame on me. Whatever. So we'll see. It's very embarrassing, but. Thank you both so much for coming on. I really appreciate you. You're capable of coming on. I want to give you guys a chance to, if you want, but I would love to. Thank you so much for coming on and talking about your expertise and talking about these important issues. So it helps Prime's audience on Twitch and here. That's what we do on these Friday night panels. So the whole goal is to try to bring on experts so that we can talk about it. So we're looking for exactly people like you. And so thank you so much for coming on. I really appreciate you.
Thank you for sharing your perspectives. Very valuable.
You're welcome. I mean, for me, I would definitely rather come on a panel and talk about women's issues or things that affect women so that we get the correct, information out there. Because that's important. And I think that hopefully that in itself will maybe kind of help regain trust in the medical system. Because it breaks my heart when I see someone come in and they have a bad outcome and it didn't have to be this way. All right. And I always tell patients, I said, please come in. I said, give me a chance to do my job. Let me do my job. Please come in. Let me do my job.
Oh, you seem like a great OB. That was not our experience on any of our stuff. That's amazing. So.
Yeah, Dr. Keisha, Dr. Sharon, we'd love to talk to you again in the future. If something like this comes up, we're always looking for, resources. We don't have a massive platform, so it's not like we can easily find people to talk about these things, but if it fits into your schedule sometime, we'd love to talk about other parts of either women's health or the medical field, industry, or whatever you might be comfortable with. But so thank you very much.
You're welcome. Check out the collective in that 30 seconds the 30-second C-section. It's a funny title, but to be honest, that was about Black maternal health and maternal health and this current situation. And oh my gosh, the clips do not do it justice, but having Dr. Sharon, Dr. Sin, and they all work, Dr. Sin though, she's not, but they work in areas like Florida and Texas. Let me just put that into perspective. So they're working in places with restrictions, with the overturning of Roe versus Wade, and sharing their perspective on that. So it was a very powerful episode. But again, I appreciate you guys talking. I just happened to come through, but women's voices, we matter. And Dr. Sharon, I love her and she matters in what she does every day. But the purpose why we do it is because I want us to give the personal side of physicians. And that's how I led during the pandemic over on Clubhouse, was talking about, I work out. Dr. Sharon works out. We do fitness. Everything I do I have 2 kids. They got HPV. I'm not playing around. I'm not having cervical cancer, oral cancer, or penile cancer in my 20s and 30s with them. So everything that I preach, I practice. And I also show the microscope on lives because I think it's important for people to see the disease And it's not a hoax. It's not made up. It really does happen. So thank you.
Yeah.
Absolutely. Awesome. Well, thank you both so much. I appreciate it. Thank you. Thank
Take
you.
care.
Yep.
Be
take
well.
Interrupt me.
Okay, I'll got you. Thank you so much.
You're welcome.
All right. Cool. Thank you guys, Dr. Sharon, Dr. Keisha. Thank you for taking your time out of your night. So, I mean, that's the exact hope of this panel, is to have people like that. This isn't like a debate night. It's a idea of people coming on, like, informed ideas and backgrounds, and so that was like an awesome treat. So thank you guys for both bringing your perspectives and your expertise and your wisdom.
We have more than enough people on the internet talking about things they don't understand, right? So
Yeah.
that's why it's just, it's so we're so grateful that those two
Very
decided to
informative.
join us. Yeah, like Dr. Keisha said, it was they were just relaxing. It was a chill Friday, but they took time out of their day to their nights, excuse me, right? To come and chill with us and share their perspective. And so we'd love to find more people, not just like that, from other parts of either the medical or the biology field, right, or just in general, who might have useful perspectives, who can come on and educate us. So not necessarily a debate or anything like that, but like discussion, understanding what you have to share. So
Exactly. Yeah, I think it's man, it's so wild, like how it's so important, like the work Dr. Keisha Davis has been doing. She's been on TikTok and doing streams and stuff for years. It's been wild since, like, it's just since at least 2021 that I've like looked back at. So it's being genuinely like a pioneer in the space too, and being like creating this like a podcast and stuff too, where it's like bringing together other medical experts in order to give that perspective and there is wisdom there. It's not easy, and it takes a lot of determination in order to come through. And I watch, and I listen in on their podcasts and stuff too, and they're really bringing themselves, which is interesting, which is really cool to see, like how like physicians like talk about things, and they don't hold back, and they're having fun with it, but then also sharing like expertise at the same time. So it's really interesting. So
and also it was clear to me that like both of them are one, like passionate about what they're doing, and also like they have like the best of intentions. And yet obviously there's a perspective out there of like, these are like the people with bad intentions, right? That's part of that animates some of that free birth society movement, right? But at least it's hard for me to like hear them speak, and like how people are viewing people like that is like, oh, they're out to get you type of thing.
Oh, Dr. Keisha just said that they actually had Representative Haley Stevens on, and who just she filed impeachment articles versus RFK Jr., which is, wow, that's amazing. Wow, that's incredible.
Yes.
Remember reading that.
Man, I feel like impeachment is the light way out. If at this point I feel like these people need to be, it is horrendous, like the information that is going out from I just can't believe that it's like I guess my larger point was like, this space is obviously really important, and these podcasts and stuff aren't just kind of they're how people understand this space now, right? That's how they understand what to do for a birth, right? They're scrolling through Instagram, and they see this like beautiful video of like a raw birth. I was talking to my wife. I'm like, I can just see the ad right now. Her like just like walking into pregnant lady walking into the ocean and then coming out with like a beautiful baby. And you're like, what I mean? I'm sure that these cut videos are the ads are just hilarious, and I saw a couple of them are like on the beach, it's just
it's like a vacation, and
yeah, exactly.
baby upstairs.
It is such a these algorithms in the social media world is how people understand reality now, and literally they're going to these spaces and like plucking the people that are leading these institutions now, not based off of expertise, but the fact that they're in these spaces. So that's what's like, it's so I guess that's my point in larger, having people that are qualified to actually speak on those things. It's just really important to in those too. I feel like that's the only way to get into algorithms that are not walled off gardens, like that's the only way. You have to.
Okay. I think I'll head out.
Okay.
Yeah.
Perfect.
But this was good. We didn't really dig into Surgeon General wannabe.
We can do that next week. There's gonna
the horror won't the horror will continue.
The horror never ends.
That's a good point, honestly. Yeah, because like I agree.
Yeah. So unfortunately, well, I don't want it to be an evergreen story, because if it's an evergreen story, that means that she was appointed and she's very but so hopefully this expires by next week. Hopefully idiots don't prevail this time, but can't hold our breath here, not with this one. But I'm actually really curious. I'm actually kind of curious at how the Republicans are going to react here, because one, I think the president's not nearly as popular as he was previously, right?
True. Very true.
There's a lot of backlash against the administration, and this might be a relatively low stakes way for them to like push back and pretend they're independent, when they absolutely aren't, of course not. But pretend they have a backbone. So like maybe shooting her down might be an easier way. And like I think there's a lot less love in the Republican Party for RFK, right? Within the establishment. Sure. So like shooting down one of his picks probably actually might work out well for them. So there's room to be hopeful about this, right? When oftentimes there really isn't. But I think there is some room to be hopeful. But we'll see.
Well, it's based off of the articles that I've read so far, but obviously we'll find out, I guess, sooner rather than later. But like it seems, my understanding is like, again, I hope it actually comes true that they're not approved. But the sentiment from the article that I read of like is pretty much like almost it's likely to happen is sort of the sentiment that I get to come across. But if they use this as a way to push back against Trump, I would love that, because like I do find it's I guess I shouldn't be surprised at this point of like the side that talks about meritocracy is going to not have someone who's like I don't know for sure, I've not looked into the data, but I would imagine one of the least qualified or credentialed surgeon generals like in history, probably.
Has to be. I mean, it's just, absolutely the worst. Yeah. I mean, other than like, I don't think it has to be. It has to be the least qualified. It has to be. Prime, you want to do your outro?
Come find me on where am I? Twitch, YouTube, Kick, TikTok. Come find Prime Kai, PRINECEYS. You see your screen there. We have great conversations. We're gonna have a debate. No, we're gonna have an actual toxic debate, not like we had today. We're gonna have a toxic debate on Monday. I was kicking around talking about the free birth thing, because specifically should these people be prosecuted or not, right? Like, should this be allowed? Can you is this like negligence? Is this manslaughter? Like should there be like legal action taken? Because I believe there's people within my my regulars, right? Who would say otherwise, that like, people are allowed to make their choices, and people are allowed to
Just like the baby free to make their choice of whether they want to breathe or
and
not,
the
right?
babies,
They make the
exactly,
right
right.
choice.
Radicals, because I'm wondering if some of our regulars there might say that, like radical responsibility. Well, I mean, like, sure, they won't go so far as to say the nonsense with the baby, right? But in terms of like, these people have choice. And I think the other thing that's actually interesting about this conversation is, and that we never actually touched on, is this idea of bodily autonomy. And was it on Reverie we were talking about this before? Just that um, like we have to be very careful when we're talking about limiting people's bodily autonomy, right? Saying that you can't do this or you can't do that, right? Especially when we're talking about women, because the moment we open that up, right? While I would say, well, yeah, bodily autonomy includes having the right to have an abortion. Others would say, like, oh, if we're making restrictions, well, then we can make restrictions on their ability to choose reproductive health care. Like the moment you open that door, like that's a big issue, right? So like, how do you handle this? Is it that like these women can't give birth outside the hospital? Would that be able? Should we impose legal consequences on mothers or anyone assisting them? If we do that, that might open up for other bad things that you might disagree with, which is where the conversation would be. So I'm wondering if we're going to do that. We might talk about that.
Yeah, no, and we touched upon it, I think, here a couple weeks ago, or maybe even last week, of like this aspect of we brought up the case of like the person that is rejecting a blood transfusion on religious justification.
Oh,
right?
this is
And
where
like,
we were talking about it here. This is where we're talking about that. Yeah.
And it's like, should the government override, especially if it's the case of a child, where I brought up that there was a Canadian case of like, I think there were like a 13 or 14-year-old that like they didn't want to have the blood transfusion, but the government, the Supreme Court intervened saying, nope, it's got to happen.
I agree with Alabama. There's no religious or personal exemptions. There you go.
So bodily autonomy includes the right to make like a bad decision, right? Unfortunately, but should that extend to people like encouraging you to make bad decisions? I guess is like
that's the thing. It's like the thing is that if you have some place that is dangerous and they are purported to be like an option A or option B, then it isn't a free will. The person doesn't have the free will because they actually have to educate themselves in order to make the right decision. So therefore they're actually levying a burden on these people, and so it's actually removing liberty in order to actually make the right decision, versus licensing only places that are hospitals, and everything else is unlicensed and illegal, that kind of thing. So I mean, they do the same with abortion centers, right? They say that like, oh, these halls need to be 10 feet wide and that stuff, which is
and
like
the tall,
so I mean, you could do like the same idea. So it's again,
an uninformed choice is no choice at all. I think what you were going with previously, that like if you don't understand the consequences of your choices, like the women, right, who the first time mothers who got involved with FBS, the Free Birth Society, like not having a proper education, which would like immediately tell you this was an awful grift, like a ludicrous grift, right? Like not having that proper education means like, yes, they're making a choice, but like not an informed choice. And like, what choice is that? And should people be held responsible for like leading them down that path? It's a tough conversation. Tough one. But yeah, and if things like that interest you, come in, find me on socials.
Yeah, and you can find me on Twitch, CoreyCam84, Twitter, X, YouTube, Instagram, Substack, TikTok. It's Corey Campbell, and from time to time on Prime Kaiser's Reverie Show. Every once in a while.
Time. He's always there. Okay. All right. All right. Well, I'll head out. Have a good one, everyone.
Okay.
Always a pleasure. Take care. Be well.
Appreciate you guys. See ya.
Yeah.